Can we play the Fauci on Chris Hayes clip, please?
Today, the U.S. set a new record high for COVID cases with a 7-day average of new daily cases at over 250,000, topping the old mark set last January before vaccines were widely available, but of course before Omicron. This comes a day after the CDC updated its guidance, recommending shorter isolation and quarantine time periods. Joining me now is Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, the chief medical advisor to President Joe Biden. Dr. Fauci, let's just start with what the actual guidance is.
The underlying purpose of taking what would normally be, if I'm infected and without symptoms, normally I would have to be isolated for 10 days. Right now, because of the concern that there are so many people now and likely in the next few weeks who will be infected by this wave of infections that we're getting with Omicron, many of whom will be without symptoms or only mildly symptomatic, that might have a negative impact on our ability to maintain the structure of society, of all the essential workers that you would need if you keep them all out for a period of 10 days. So the consideration and the decision on the part of the CDC was, let's look and see if we could cut that in half to 5 days.
Can we pause?
Yes.
So there's something misleading going on, which is he's talking about essential workers and preserving the function of society. That's something
structure of society, I believe. Yeah.
That's something that was language that we heard in March and April of 2020 when there were some paid shutdowns, when people got pandemic unemployment assistance to go home and keep themselves safe. But we have these essential workers stay, a minority of workers stay at their jobs. This rule, this guidance rather, does not only apply to essential workers. It's meant to apply to the people at the mall, at the restaurants, at businesses that could either be restricted or closed in a different world, or in other countries like in Canada, which is temporarily closing some businesses.
He's kind of making it seem like he's talking about essential workers, but this is something for all workers.
Exactly.
And he's using language to make it, yeah, right. I mean, I'm not someone who hates Fauci. And one of the reasons I'm so frustrated by this is because it gives, I think, there's so much skepticism already about vaccine hesitancy. And this, to me, just gives so much ammo to people who are either confused or have lost faith or trust. And it's like, you shouldn't be undermining yourselves like this.
Yeah. I mean, I just have to say, just having worked for a health department, again, it's not the CDC, but I suspect they are just having to follow what the party line is and what they're being told. I mean, these are incredibly bright folks. I mean, I do have to say, Dr. Fauci, Dr. Walensky, like, they're not public health people, like, they're medical people. Right. So I think we actually don't have public health leadership, really, as part of this White House response, which is like a whole nother but related issue.
Right. Yeah, and the person you're not seeing in all of this is the person with the most power over pandemic response, Jeff Zients.
Right.
He is as little of a public health person as one can be. He has a background in private equity, Bain Capital. He's the one who's really running the show with COVID response policy, and we're seeing people like Fauci and Walensky having to sell policies not made by them.
Right. Let's keep going.
Normally, I would have to be isolated for 10 days. Right now, because of the concern that there are so many people now and likely in the next few weeks who will be infected by this wave of infections that we're getting with Omicron, many of whom will be without symptoms or only mildly symptomatic, that might have a negative impact on our ability to maintain the structure of society, of all the essential workers that you would need if you keep them all out for a period of 10 days. So the consideration and the decision on the part of the CDC was, let's look and see if we could cut that in half to 5 days. So what happens is that you're isolated for 5 days, and then if you're still asymptomatic, at the end of that 5 days, you can go out and do your job and re-enter society, hopefully getting functions of society normal but you have to wear a mask.
You are talking about policy judgment in a context of trade-offs between different consequences. So stopping the spread of a highly communicable infectious disease is one thing that we want to do. Allowing, as you said, society to function. Obviously, like, you don't want everyone at the local water treatment facility to be out in quarantine for 10 days with none of the skilled technicians running it, for one example, okay?
Correct.
But, and I get that, and I think it's a very forthright explanation, but I guess the question is, like, is there any science backing up the idea that after 5 days of asymptomatic isolation that you're not still shedding virus and contagions?
Yeah. Nothing is going to be 100%. And this is one of those situations when you're dealing with a very difficult situation, Chris, that we often say you don't want the perfect to be the enemy of the good. The fact is that we know that when you are infected early on in infection, for the first several days, you have more of a likelihood to have a high level of virus and to be capable of spreading it. As you get into the second half of that 10-day period, we know that the virus in general, not for every single 100% of the people, but for most of the time, for most of the people, that level of virus diminishes to the point where the CDC feels, and I don't disagree with them at all, that wearing a mask is ample protection during that second half of a 10-day period.
I just wanted to say, like, they're just, a lot of like concerning issues with what he's saying. I mean, I think, just in terms of wearing a mask, like many people, the guidance from the CDC around like well-fitted masks, I think is the terminology they use. I think it's either for like a cloth mask or maybe a surgical mask. We're not talking about like N95 masks, and we know that many Americans don't have access to these higher grade masks so that they can protect themselves. And then I just wanted to add also that, we know some of these, like the Delta Airlines CEO, sort of reached out and was, with Dr. Carlos Del Rio and I guess their medical director, to ask about the shortening of the isolation period, but they had also asked around about a testing requirement where CDC completely like dispensed with any testing requirement. I think we're all clear as to why, because of the lack of availability of tests. But the fact that they're like not honest about why there's no testing requirement, I think is like further erodes like any existing trust that was present previous to Monday. Just the fact that they're just not being honest. And I think, all these people are in very challenging positions, but this is just not helpful at all.
It's just very frustrating to watch. And, I think this was yesterday. Today, there's been many more appearances by Rochelle Walensky and by the deputy director of CDC trying to explain the science behind the decision. And there really isn't much.
Yeah. So that, I mean, I guess the question is, Chris Hayes, when he mentions the water purifier example, right? He's like, well, you obviously need some people back to work. So how do we balance needing, for instance, I mean, as you pointed out, though, this isn't just about essential workers, right? That's part of the issue. But how should we be balancing the needs of people, of patients with the needs of healthcare workers, kind of more generally?
Yeah, I mean, I think like if you're talking about how do we do a better response, I think right now we're at such a high level of spread that in so many places hospitals are going to be overwhelmed. And we've seen, I've been tracking the data in New York City in the last week, hospitalizations have more than doubled. There's still plenty of capacity so far, but what if it keeps doubling? We really don't know where it's going to end. And in other places in the country really have very little hospital capacity and are still only dealing with Delta. Omicron hasn't even hit. So I think what you want to do ideally is make the resources available to keep people safe temporarily we used to call it flatten the curve, make sure the healthcare system doesn't get overrun. And then the remaining workers who have to go in person, I would like to see them get hazard pay, and I would like to see them get a very high level of occupational protections, ventilation, N95 masks, et cetera.
But how are we going to pay for it, as they always ask about everything but the Pentagon?
I mean, there's funding that was sent to the states. I mean, so many states do have, resources to do a lot of this. I just think that there need to be, like, the Biden administration needs to use whatever levers of control that it has, and it really hasn't sort of maximized those. So even things like creating, guidance for states about, mask policies. So what are the levels of community transmission at which we want to make sure that we have people masked in indoor public places? Like, there's just very little guidance that has been developed at the federal level for states and localities. And we know that a lot of, like, state policy can be influenced by federal guidance, and that's really not happening. Like, the CDC has really stepped back, and part of Biden's initial plan was really about working with state governors, working with local jurisdictions to get them to adopt a number of these policies. And it seems like the White House has just really given up.
Right. In a way that, I mean, there have been these memes going around, like how it started, how it's going. Thank you. I seem so out of touch. How it started, how it's going. And it shows Trump saying something comparable to what Biden is saying now. And then people get defensive, how could you compare the two? But the point is, one of them is president right now. So some people who are saying, but Trump, that's not enough. You can't just say that. You can't just do the but Trump thing, because Trump isn't president. And the other thing is, like, of course we should be pushing Biden. I mean, Biden's press secretary joked about how ridiculous it was to give out free tests. And then lo and behold, that became a policy. So, to my brothers and sisters out there who are feeling protective of Biden, you're doing him a favor. To all three of you watching the show tonight, who define themselves that way. But we also have some Walensky.
From what you're saying, it sounds like this decision had just as much to do with business as it did with the science.
Well, so it really had a lot to do with what we thought people would be able to tolerate. We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of people are isolating when they need to. And so we really want to make sure that we had guidance in this moment where we were going to have a lot of disease that could be adhered to, that people were willing to adhere to, and that spoke specifically to when people were maximally infectious. So it really spoke to both behaviors as well as what people were able to do.
If I can intervene on that first clip.
Yeah, of course.
She's talking about people. It's not really about people. Like, yes, there are individuals in their own capacity who go to the CDC website after they're infected or exposed to say, okay, what do I do now? But that's really not what this is about. This is about policy, and it's largely about businesses and their quarantine and isolation policies that they adopt voluntarily. And in some states, it does have force of law. In some states, there are protections for workers who are quarantining and isolating. So she's putting it on the individual when it's really about business.
Yeah.
Right. And just to add to Justin's point, like, that's just been the CDC's approach in general. Like, this has been a very individual sort of level response in terms of people, like, get out, get vaccinated, and blame people for being unvaccinated for the situation we're in, as opposed to the reason we're here is because we haven't had the appropriate policies in place.
Right. There's a lot of shaming that's going on.
Mm-hmm.
Rochelle Walensky is the director of the Center for Disease Control and Prevention. Dr. Walensky, good morning. Thanks for joining us. We want to start, if we can, with the CDC's recent decision to cut that isolation period in half. Given that you and other public officials have acknowledged that it wasn't exclusively science, but also those possible staffing shortages that played a role in this decision, should Americans feel safe?
Good morning, Peter. Thanks so much for having me. So we followed numerous areas of science in making this important decision. One, of course, was how the virus behaves. How much virus do you still have that you could potentially transmit after 5 days? And we generally know that most of your transmission potential happens in those 1 to 2 days before you have symptoms and those 2 to 3 days after. So by the time 5 days of isolation has occurred, you probably have about 85 to 90% of all of your transmission potential behind you while you've been in isolation isolation. Importantly, also to that decision was where we are in the epidemiology of this disease. Skyrocketing case numbers, as you have noted, we anticipate they could get even higher. And many people are asymptomatic or only mildly symptomatic, especially those who have been vaccinated or boosted. And so they may very well not be able to or willing to comply with 10 days worth of isolation. So this was really a way to tell people, make sure you isolate in those first 5 days when you're maximally infectious, and then of course wear a mask for those last 5 days to make sure that you don't spread anything that might be left over to others.
I mean, it's kind of more of the same, talking about individuals rather than businesses, and that like we've gone through the mask stuff, and then yeah, she's throwing out some numbers, percents when people are infectious. It's not exactly clear what she means by that, and according to the New York Times, she's talking about some internal modeling they did based on the Delta variant, not the Omicron variant.
Right. Yeah. And she seems to, I mean, I'm not a scientist or a doctor, but she throws around a lot of like probably and generally.
Right. Well, I think there's like a lot of uncertainty, and I think like it's helpful, you know, as a public health person or scientist to say, you know, when there is uncertainty. But we do know there's a lot of variability in terms of like duration of time during which people are infectious. And so does she want to be around like a colleague who's in those last 5 days, like wearing a mask? Like, would she feel comfortable? This is like the reality. I think most people would probably say they wouldn't want to be around someone who is potentially, you know, infectious, even if they're wearing a mask.
Right. Bus God writes, Dem leadership is asymptomatic progressive. I don't even know if they would diagnose themselves as progressive, but they certainly are not showing symptoms. And now for something completely different, or a little different, we're going to see the wonderful, I don't know, I think the CDC and the NSA and the CIA, they're all interfering with my stream here.
Joining me now is the international president of the Association of the Flight Attendants Union, Sarah Nelson. Sarah, thank you so much for joining us this morning. And first, I just want to get your reaction to this new guidance.
Well, look, this came in the middle of the busy holiday season at the behest of Delta Airlines when they started to see that they were going to have staffing troubles. Other airlines negotiated incentive pay to try to get through the holiday period. Delta did not do that and doesn't have unions. And so CDC responded with a cut in half of the isolation time when someone is infected, with no testing before going back out into public, but with two key points: that you are asymptomatic and that you continue to wear a mask. It's really important that we lift this up, and CDC should also be recommending, if they're going to fall in line with what the airlines want, that the airlines also say how they are going to implement this to make sure that it is only for people who are asymptomatic who are coming back to work, so that people are not forced to come back to work when they're still sick, and how they are going to implement ensuring that masks are worn at all times, including in the flight deck.
Right. And so they say that people should continue to wear a mask for those 5 days after they are asymptomatic, if they go back to work. But you said, you talked about, you know, the CDC citing the science here as the driving force behind this decision. But you said the fact that it aligns with the number of days pushed by corporate America is, quote, less than reassuring.
Look, it was totally transparent here. This was asked for as these staffing issues were being put in place. Delta's statement after this policy was put into place had not an ounce of public safety in it, but it was all about the staffing issues. That's what was argued on the front end. That's how your segment started today. And that is the quick response from CDC in the middle of this holiday season to try to address that, rather than be focused on public health policies. And I want to make it very clear, the CDC should be loud and clear about implementation here, because no worker should be forced to come to work when they are still sick. And that is, I believe, what we are going to see here. We're very concerned about that.
Yeah. Just to add, I think I saw like a tweet on Twitter today or yesterday, a viral tweet where I guess someone was diagnosed with COVID-19 and told their boss, and boss was like, "Oh, don't worry, if it's mild, just come in." So I think, you know, this is probably going to be, you know, happening, you know, throughout the country, and obviously it's incredibly concerning and will obviously potentially worsen the current situation we're in. So none of it really makes much sense.
And the Biden administration, I think, is worth noting, actually went much further than the airlines asked of them. The airlines were saying, if you're vaccinated and have a test and are asymptomatic, you can come back. They're not, the Biden administration is not put in any of those in the guidance. They're saying any job, doesn't matter vaccination status, doesn't matter if you test positive or don't test at all. If your symptoms are resolving, whatever that means. It seems like what's happened here is the Biden administration saw thousands of flights canceled over the holiday season. And in New York City, where Omicron seems to have a little head start, they're seeing many businesses close down, and they're worried about their economic goals. They're worried about businesses shutting down. They're worried about inflation, that sort of thing. So they're pushing workers to put their lives on the line for their understanding of economic progress.
To play devil's advocate, what about, people say, well, we need economies to function. We need the economy to function for the little people, not just corporation, not just corporate America, but people can't afford inflation. You hear all these arguments. So what's your response to that?
Well, just to say, I think when we look at like countries across the world that have like prioritized like the health of their citizens, like those are the ones that have then been able to really maintain relatively strong economies, and those that have not prioritized the health of their citizens then have had really struggling economies. So the reality is that, if we were having unabated spread of this virus, people are not going to be able to show up. Like Omicron's going to shut things down. So instead of having Omicron shut things down, let's do this in a way that like is sensible and really prioritizes the health and well-being of Americans and American workers.
Yeah, and I'd put it this way. There's a major new risk in society, COVID, and someone has to pay for it. Either government and business can pay for it, or workers can pay for it with their lives. I did research covering the first year of the pandemic, and I found that if working age people of color who had high school degrees or less, so people of color who are working class, if they died at the same rate of college educated white people, 90% fewer of them would have died. So we really have both a classed and racialized pandemic that is having extremely unequal impacts depending on who you are and the kind of work you do and the kind of housing you're able to live in.